Ma'am.
Yes, good afternoon.
Dear participants, good afternoon. We are on the second last session for 12 days ECHO webinar program for newborn nurses. Today's topic is communication skills and infection prevention in newborn. I am glad to welcome today's speaker, Dr. Aparna Mushinkale ma'am, Professor Bharati Vidyapeeth College of Nursing, Sangli. Thank you, ma'am, for accepting our invitation. I just welcome you for today's session, being a resource person.
Thank you
Madam's
so
background, including PhD from Bharati Vidyapeeth College of Nursing, Pune, and she's having 28 years of experience in the nursing field, that is clinical practice, education, and administration. Her achievement, including she's a research coordinator for MSc course from last 8 years, institutional ethics committee secretary from last 4 years, research guide for PG students since 12 years. Total project guided for PG students is 15, and total research projects guided for UG students is 12 groups. Total PhD guide she is 3 students, and she have 32 publications into her credit, which is in text journal like Scopus, PubMed, and UGC in text journal. Her awards and achievements including Global Excellent Educator Award by Academic Research Foundation Bangalore, Asia's Best Teacher Award from Eduveda Foundation for Academic and Research, Young Researcher Award by INS Institute Scholars Bangalore, Teacher Excellent Award, and the list goes so on. Her membership including Secretary for Institutional Ethics Committee, maybe Bharati College of Nursing, Sangli, is Academic Coordinator, Institutions Innovation Activity Coordinator, and she's a chairperson for Internal Complaints Committee, and so many to her credit. I welcome you, ma'am, for today's session, and thank you for accepting the invitation, and thank you for sharing your thoughts for the young minds.
Thank you so much, ma'am, for introduction. I'm very much happy to be part of Bharati Vidyapeeth College of Nursing Sampling. And I would like to congratulate respected Dean and the Principal, Dr. Vaishali Vadhu, Madam, from the Bharati Vidyapeeth College of Nursing, Mumbai, as well as all our pediatric department for organizing such a wonderful webinar, which is really very useful for all our students and even for the staffs. So thank you so much. And, you permit, so can we proceed with the
Yes, ma'am, you can.
today's? Yes. Let me share it. Just let me know whether it is visible on your screen. Is it visible? Is it visible?
Yes, ma'am, visible.
Okay. And now,
Yes. You're not audible actually.
yeah, just a minute.
Ah,
Yes, I think which, like, Now, is it visible? Hello?
Yes, ma'am. It's
Yes,
visible.
yes, ma'am. It is. So let's start with our today's topic. It is a communication skills and the infection prevention in the newborns. So overall, if we'll see, we say that newborns they does not show the emotions when they born, but actually, if we'll see, they have various methods of emotions to express, and they respond to the environment, and they attend and respond very eagerly. They have a talk since the birth itself, but just being as a parent or being as a nurse, when we work into the ICU, we should able to recognize their the communication or how they communicate. We consider that the babies they start speaking at the age of 8 months, like a monosyllabic, and then further to the bisyllable. But if we look the babies they talk and they start a communication soon after the birth itself, and that connectivity is there with the parents and the even caregivers when they are admitted, if they are admitted into the NICU. And when we have a communication with the babies, if we understand their behaviors, their coos are there, the vocalizations are there, so through that they speak with us. So only the thing we need to understand that, and if we have this communication with them, then definitely it helps the babies to improve their brain activity. The synapses also will be developed. The super fast rate will be developed. So more than 1 million per second in a few years of seconds only. The baby, we can see the fire ups will be there, and the synapses will help to handle the language into the baby. So it is very important that the we should get connected with the baby, and the process of communication should start from the birth itself. So, what is a communication? Communication in any way a baby interacts with the world, including, as we say, they need emotions and the reactions they share. So that communication begins immediately after birth. So while newborn, they can not speak, but still there are some few non-verbal cues are there. They have different sounds to express. Even the facial expressions are also there. So we need to identify, and through that and these ways, the babies they communicate with us. So there are different types of communications in the newborn. So first is we can see there are the non-verbal communication as well as the vocalization is there. So in non-verbal communication, how the babies speak with us, they cry. So through the cry also they express various emotions, their feelings to us. So the primary communication tool is to express their needs, and then after that they have a facial expressions also. So through the facial expressions like a smiling, fawning, okay, then showing the anger, raising the eyebrows. So these are the various communication. The gestures are also there with the babies that we need to understand. Then they have even a eye contact. Eye contact also, with that the baby begins to communicate with the parents as well as to the caregivers also. And then the body movements are there where they will show the gestures like grasping, kicking, and head turning is also there. So we are going to see how they correlate and how what they want to say through these gestures, and how I can we can identify what is the need of the baby, because the baby cannot express vocally, or they cannot speak. So we as a caretaker, we need to understand their feelings and the emotions. Then the next is vocalization, where the baby will give some coos, they bring out some sounds, then vowels will be there, soft sounds are there. So to express the contentment as well as they express the discomfort through all these vocalizations also. Crying, if you see the crying in the communication, there are different types of crying is there. Hunger cry is different when the baby is crying. So many times the as a parent or the caregivers, we don't understand why the baby is crying. So we see the multiple things and we assess the why the baby is crying. We need to identify that. So how the cry is there. So through that different types of cries are there. So if the baby is crying when he is hungry, that time that cry is a short, rhythmic, repetitive is there. Again and again the baby will cry. Pain cry, how it will be? It will be very high pitched cry. The sudden they will start to cry and the intensity is more. When they sleep, that time also sometimes the baby will cry. So it is a very less intensity is there. Discomfort also when the baby have that time also they will cry. So that cry how it is when the baby is discomfort, it is a continuously and it is a fussy. So very important that we need to understand the need of the babies and we need to meet those needs. So as a caregiver, it is very important that we should identify what type of cry it is and what is the need of the baby. So we as a caregiver, we need to respond based on the pulse of the babies to meet their needs. So see, just now we have seen hunger cries there, see pain cries, see very intensity we can see by the facial expressions. Okay? How the eyebrows are like a clenched, the mouth is open, the tongue is touching to the like a yeah, they have raised up. Then the sleep cry hai. So continuously it will be fussy is there, discomfort cry. So completely baby is fussy and he is showing the body gestures also. So likewise the different cry are there that we need to identify what is the need of the baby and why the baby is crying. Because suppose he is hungry and we are just making the baby to sleep. So he will not sleep if he is in a pain, so if we give just a feeding to the baby, his need is not met. So we, as a caretaker or in the family also, we need to teach to the parents also what type of cry are there different and how we need to identify so that the need can be met for the babies. So here also we can see the different the facial expressions are there. So with that we can identify how the child is crying when he is hungry, when he is discomfort, the tired, how the crying that is a very different. So by the facial expressions only and the eyebrows also we can understand. The burping cry is different. The belly pain is different. So these are the different cries are there. So hopefully we will see this. I want to show one short video to you. Let me see. I think it is not getting open. Hopefully it will open. Let's see. Hmm, परत जायचंय मला माझ्या PPT कडे. Let it be. It's not opening, so continue with let's see afterwards after some times. So you can see on the YouTube also it is available. The video is there where they show that there are the different the cries are there, and the baby will give the different like they use a different words how they cry, and how we need to, as a parent or a caregiver, we need to identify that. Then the comes as a facial expressions. The baby speaks with us with the facial expressions also, where they can smile, they can like a frowning will be there, widening of their eyes will be there. So through that also they will communicate. So early smiling also begins, we know, 6 to 8 weeks. So where they express the pleasure and the recognition is there. When they start the recognizing the mother and the parents, the caregiver, they smile. So they show their whatever their feelings and emotions through the facial expressions also. Eye contact is very essential, because through the eye contact the baby will show their bondings and it will communicate very strongly. So maintaining eye contact and the nodding to show understanding is very necessary. Not only making eye contact, but when the baby will speak, means when we speak with the baby, baby will give some sounds. Okay, so cooing is there. So that time we should also nod our head, or we should show that yes, you are understanding what he is speaking. So that shows the understanding, and it is very necessary when the baby will speak with you with the facial expressions. So here are different facial expressions. From that also we can identify when the baby is happy, when the baby is sad, when he is having a fear, or he's angry, or he's surprised also. See raising their the eyebrows. Okay, then if neutral is there, no any expressions are there. So different expressions and the facial expressions the babies will show, we need to identify that. So through the facial expressions also baby speaks. Then after, the body language is there. With the body language also the baby speaks. What body language they will use now? They show some instinctive reflexes, like a grasping is there. So when we touch to the baby, baby will hold our hand, so that shows the grasping is there. That means they feel very secure when they grasp. So that grasping is there. Curling is there. Toes or the sucking is also there. So with that sucking also we can see that body language will show, they will show the pleasures also. So there are some intentional movements also there. Newborn begins to move purposefully, like reacting out for the objects or the caregivers. So these movements will indicate that they are developing the motor skills, and awareness is present in the baby. So cognition is also developing simultaneously. So they show the jerks also when they are excited. So many times you see the baby when they are sleeping, so they are jerking their legs. So they are very excited, or they want to play that time. So likewise, the body language also we need to understand, and then baby will smile. So that time we can understand, yes, the baby is safe. The baby is crying, that means the baby is having a discomfort. So with the body language also, the baby communicates, and we need to identify. Okay, so there are some hunger cues are also there. With the body language, they speak when the baby is hungry. Like they are licking lips, opening mouth, or smacking some sound also will be there. Or if they are hungry, they will chew the feast or anything else also. Okay, they will clench whatever the toys will be given. They also will clench that. Then the clenching of the feast is there. Or rooting with the mouth wide opening is there. Okay, they sometimes the baby will stretch their body. That time they will show that they are hungry. So they want to express their hunger with the different us, and we need to identify that. So these are some different hunger cues are also there. Sometimes the baby will cry, turning they turn to red completely. So likewise, we need to understand their early coos as well as the late coos are there. So that we need to identify. And when once we identify, we should cuddle the baby. We should stroke the baby. Take skin to skin can be given, and the breastfeeding can be given so that the baby will feel comfortable and his need will be met when he is hungry. So if you'll see the when the baby is hungry, the baby will clench the feet, and when baby is not angry or relaxed, the feast will be opened. So this is the body language through that which the baby speaks with us. Okay. So there are some different body languages are there, like a hugging is also there. Where through that the baby speaks. So it could mean that your baby knows that he is feeling better, he is feeling safe. So they come and they hug too. So likewise, this is also one gesture that maybe when they are safe and they feel comfort, so that time they come and hug. Then rubbing and covering eyes. Many times we feel that something has gone into their eyes, but when the baby will rub their eyes, when the baby is having worry, and then they show through their these gestures that they are having some worry or they are tired. So that we need to identify the breast. So that time we should understand ki his needs are met. That is what they are showing by turning the face. So when the mother is feeding, that time when the baby is taking to feed, that time also they will turn the face. So likewise, looking away, through that also they show the gesture. Kicking, as we discussed, that when they want to play, when they are happy, they will kick. So as the parents or the caretaker, we can see the balloons are also attached. One picture you can see that when the baby is kicking, the balloons will that they will just they also will jump, so baby will enjoy that. So because he wants to have a play, so that time this activity we can do, or the creativity also can better, so that his need can be met. Then sometimes the baby will show the grunting. So like a some babies grunt will there because they are uncomfortable, and that time they show that some sound grunting sounds will come from and they will show that they are discomfort is there. So this what we have seen about the body languages. Then the vocalization, as we have seen, the vocalization they, starts and the when the baby is born, that time only the coos they will start, and that time 4 to 6 months baby start experimenting the raising the pitch and the volume also. So caregiver responds to these sounds, and then we can enhance the communication when we are responding to these sounds. So what is the importance of early vocalization? It strengthens the caregivers, and the baby's bonding will be strengthened, as well as it will stimulate the cognitive and the speech development also. Then these are the some few baby coos is there where they show that they want an attention. So when they want attention, what they will do, eye to eye contact they will maintain to the mother or the caretaker, and they will try to coo with the giving sound like that. That's the cooing. So baby, the coo, the turning head towards the mother or the caretaker is also there when they want attention. So if you are standing there, they will look towards you and then they will start cooing. So that means the baby wants something from you. So that also we need to identify. Then sometimes the reaching out to another coo is also there. So when the mother or the caretaker will come to the baby, baby will raise the hand and they will show that ki, just you lift me up or take with you to me. So they want to move around. So this is what we need to identify. They want attention. So that time they show these gestures. So I need a break or the change of the activity. If it is there, then the baby's schools are different. So what they will do? So they will turn the head away from the mother or the away from the parent. That means they are telling that they need a break now and they want to go out or they need a change of the activity because they are also bored, no? Sleeping all time into the bed. So it's really, as a parent or the caretaker, we need to identify their needs and we need to meet their needs. Okay. So again, arching the back and the crying is also another way that baby will show that they needs a break or they want to go out. That time when you carry the baby, that time you can see the baby is arching his body and they want to show that they want to go out from here. So that means they need a break. Okay. Then after that, they try putting the baby on the floor to play also but they don't sleep, they just cry and cry. So here they shows that the baby is tired. So when the baby is tired, the baby will show you yawning, rubbing his eyes, the jerking the arms, legs. Okay, so likewise they will show that they are tired. So these are the stages of vocal development. First 2 to 4 months they start with the cooing. I say no, ooh, ooh, ah. Okay, goose. Likewise, they will create some sounds. Then 4 to 6 months they will laugh. Okay, they start with a giggle. Then vocal play is there, like they are making some sounds. The school sounds is there, clicking. Likewise, they will do. Early babbling is there. Okay, ba ba ma. Okay, that is a babbling. Then 6 to 8 months may reduplicative babbling is there. Whatever the we so see say that again they say they repeat it also or duplicate also they will. Okay, so whatever we do. 8 to 10 months, non-reduplicative babblings are there. Okay, they will say that the vowels will be differ, like a ba, ga, ma, ba, ka, ka. So different vowels they are using and the learning. Then 10 to 12 months, the jargons will be there. What is a jargons? They start to sound like adult speech, but they feel that ki whatever they are saying is the right what the mother is saying. That means if suppose mother is saying food, okay, but the baby is saying what ma, है ना, ma, da, pa, mum, mum. For water, they say most probably the mama water. So these are the jargons. They use some different words and they express whatever they want. So these are the jargons. Then word approximation also will be there. That we know after that the baby will start 8 months the monosyllable and after that the bisyllable also. So understanding and responding to the baby is very necessary because when we respond, the baby is feeling happy and they now understand ki, yes, my need will be met and the bonding will be more will be there with the parents as well as the caretaker. So the different if you see into the animals also the carrying gestures are different. So oral carrying is there, dorsal carrying is there, ventral carrying is there. Into the human being also the ventral carrying is there because that carrying will give them the sense of satisfaction and the safety. So if the rodent is there, they are having oral care. Okay, but where the baby will feel secure, baby will not be anxious. Okay, likewise it is in the human also, the ventral carrying where the baby will feel the secure. So bonding is very important. Babies are speaking to us and they are communicating with us with the body language, vocalization, and different gestures. Okay, so but we need to understand that once we understand the bondage or the bonding will be developed. So bonding also will be developed through the cuddling. Okay, it is there. So that also very much important that through the cuddle also the baby speaks. So this is also one way of communication that they will feel that yes, I am comfortable and they listening to the heartbeats of the mother also where they are listening those heartbeats when they are in homes also. Yes, so that connection is very much strong. So always we should tread ventrally and the baby can listen to the heartbeat of the mothers also. So bonding through the contact is also there. Skin to skin contact, if the body massage, if it is given, baby feels secure. And always that soothing touch, they will feel that yes, I am safe and my needs are met. So with that, they will feel relaxation, and then they will be happy once if the next time you are giving massage. So that means they know ki my needs will be met now. So they will show some gestures that they are happy. They may kick their leg, they may raise their hands towards you. So likewise, this communication is also very, very important, and we should understand eye to eye contact, facial expressions. We need to understand. Okay, then the good bonding will be developed when the voice will listen to what the baby is speaking, and the baby will listen to the mother. So that the communication between two people is very, very important. So where this conversation will really the baby will feel comfortable in the conversation. So, talking to the baby is very important, and chatting to the baby throughout the day. So, we should speak with the babies continuously. So, then only they will learn the words, and slowly, slowly, they will also communicating with us. So then as the baby grows, then we can show from the books, vagera, the stories, vagera. Okay. So likewise, the communication will develop. And when the baby wants to play, when they are sleeping, that time we should also try to play with the baby. So, we can sing. So these are the some other language skills are there. So that with the language skills, if you'll do the gestures also like a twinkle, twinkle, little star, if you'll do, the baby will also start doing like this. That means they are also showing the gesture. So this is what is very important, to have a bond between the baby and the mother or the parents or the caregivers when we are taking care of the babies, so that the baby also will start to have the communication. They understand our communication. But as a parent, it is our challenge that we should understand the baby's communication. Smiling towards the baby. Okay, the baby also will smile. And they, because when they will smile, we know that the chemicals are released and the brain also will develop. Some games we know that we are playing since our childhood, and we are playing with the children's also. This is a peekaboo. Okay, it is very common. Okay, taking one cloth and removing, and we are saying bow again like this, or that is called as a peekaboo. So where the baby will be very happy, and the movements will be there, the skills will be developed. So this, as a parent or the mother, it is very, very important that we should have a communication with the babies. And why? Because the impact of communication is there on the development. Cognitive development will be there. Okay, because interaction with the caregivers will stimulate the brain growth as well as the learning abilities. Okay, the babies will smile, they will have eye contact, vocalization is there. So cognitive skills will be developed. Then the emotions also are developed. Emotional development will be there. Okay, because early communication will build the emotional intelligence, and baby learn to express, regulate the emotions through the interaction, as well as they will have the social development also. Because once we start the communicating, babies also will develop the social skills, that they are smiling, and they are showing their empathy. They are recognizing the emotions of the others also. So these developments are very, very essential when the baby is growing. So the communication plays a very important role when we are taking care of the babies. So that responsive care is very essential to foster emotional and the cognitive development. So early communication lays the foundation to the overall development of the babies. So understanding the newborn's communication is very, very necessary. It helps to strengthen the bond between the caregivers and the babies, and the support healthy development in all the areas. So this is, we have finished with the first part, that is a communication skill. Ma'am, how much time is left?
20, 25
Hello.
minutes more, ma'am. 20, 25 minutes more.
Okay. So next is a prevention of infection in the newborn. This is also a very important topic. So infection, we know it is a leading cause of the neonatal death in the developmental countries are there. Okay, because the many susceptible infections are there. The lack of the natural immunity is there. So again, they need to develop their immunity. So There are many reasons where the baby will fall sick and the chances of infection will be there. But as intensive care nurse, as well as at home also, the parents, as a parents, everyone should take care of the babies, and prevention of infection in the babies is very, very important. There are infection occurred before during the birth also, or during birth, like toxoplasma, rubella, cytomegalovirus, herpes is there, varicella zoster is there, okay, chlamydia infection, hepatitis B virus, syphilis is there, gonococcal, ophthalmia neonatal. You can see that through this also this infection can acquired. Even the infection acquired after birth also it is there, like a skin infection, tonsillitis, respiratory infection baby will have, nasopharyngitis, then neonatal pneumonia is there, gastroenteritis is there, necrotizing enterocolitis is there, urinary tract infection, meningitis. So, a number of infections can be acquired even after the birth also. So, we need to understand and the infection signs and symptoms, because then only we will identify the yes whether the baby is having infection, and the prevention is very, very important. So if the signs of infections the baby shows, like a poor feeding, breathing difficulty, decrease elevated temperature, unusual skin or the rash, change in the skin color, persistent crying, unusual irritability, if it is there, so then there are chances that the baby is having the infection. So, what are the general nursing infection prevention practices we need to follow in NICU? That we need to start with the physical setup itself, because it is very necessary that how the physical setup is there. It should not be too crowded. It should not be there. There should be isolation room should be also there. Then it should be near to the labor room should be there. The temperature of the NICU should be between 72 Fahrenheit to 78 Fahrenheit, that is 22 centigrade to 26 centigrade. All nursery and NICU entrance should have the elbow and foot operated. The soap dispensers and disposable towels also should be there. Avoid crowding in the nursery and into the NICU, because many times the parents are also anxious and they also try to come again and again into the NICU, but it should be prohibited, as well as the staffing pattern also need to be taken care, so that crowding will not be there. Then hand washing is very, very important. Nurses should remove the rings, the watch, bracelets when they are dealing with the babies, because they carry the infection and we will give the infection to the babies. So it should be removed. Fingernails should be trimmed and no false fingernails or nail polish should be used. Nurses should wet hands thoroughly, washing them 15 to 30 seconds with the soap and running water, and then rinsing hands under a stream of water, then drying them with the clean paper or the even towel, clean towel. Towel should be changed every day after use. It should not be used the repetitively. So these are very, very important things we need to follow. Then hand washing is necessary even when the gloves has been worn. Sometimes the doctors or the nurses feel that we are wearing gloves, so no need of hand washing. They will just remove the gloves and again they will go and touch to the other baby. No, we should, though we wear a gloves, we should see that the hand washing should be done thoroughly. Because through if the hand washing is not done, the many microorganisms we are giving to the baby, and baby will fall sick with the infection. So it should be immediately followed and removed. That glove should be removed, and then before touching to the another baby, the hand washing should be done. And that hand washing we need to teach to the parents also, that before and after touching to the baby, we should do the hand washing. Even in the NICU, if you touch to the baby, always see that the before touching and after touching to the baby, thorough hand washing should be done. And even though after the any procedures, if you are done. So there are the 5 movements for the hand hygiene. That is, first, before touching to a patient or the baby, you should wash the hands. Then before clean or aseptic procedures, if you are doing, and after touching to the baby, then after touching and to the surrounding area also. And if your body exposure is there with the fluids, or if any other material also there. So this is very, very very important that we should follow this the 5 moments. Then thorough hand washing के लिए very effective to use this all the steps should be followed when we are doing the hand washing. Hand washing but must be at least 40 to 60 seconds, but we can see that it should last for 40 to 60 seconds, but at least it should be hand washing should be done 20 seconds. Okay, but it should be last to 40 to 60 seconds is there, followed by the alcohol based hand sanitizer. Then for the using the hand rub also with the alcohol hand rubbing, it should last for 20 to 30 seconds, and it should be performed by following all the steps illustrating the figure which is there. And the 2 cc of gel we can take as less amount, and it can be dried within a 15 seconds. So there is again the method of taking the hand rub also, and how we are doing hand washing. Likewise, also the hand rubs can be used. So there are general nursing interaction prevention practices are there, that good routine care that we need to follow. That neonate should be bathed 3 times per week using a baby soap. Actually, once the new baby is born, that time the initially practice was there. When the baby is born, that time only oil will be poured, and all the vernix caseosa will be removed completely. But nowadays that practice is stopped. We are not removing the vernix gaseosa because it will help it to maintain the temperature into the baby. So it is said that at least 3 times per week the baby can given a bath. Electrode should be changed every third day if it is attached into the NICU. The umbilical stump also need to be cleaned with the alcohol at every shift or whenever it is needed. Prophylactic eye drop can be applied for the first hours of life. Replace the IV fluids daily. Cannula should be changed every 72 hours. So what we can do, we need to write a date and the time on the adhesive tape, okay, so that we can understand when the cannula has been inserted, and if we need to sorry, change the cannula. So feeding tube should be changed every 2 to 3 days. Change breathing circuits of the ventilator or the CPAP every 3 days. So it is very necessary that all practices should be followed, and we should not place 2 or more babies in the same cot or the incubator. Because again, the infection can be there. The cross infection can be there. The nurse must worn a gown, gloves, and direct contact with the baby. She should follow these protocols. Then the when she is handling neonates, until the blood and amniotic fluid is removed from the skin, nurse should wear a glove. That is very important. Then she has to wear a closed toe shoes. Okay, if one gown is used repeatedly for each baby, the nurse should discard that gown. What is the actual practice is there? when when we remove gown, okay, yeah, many times in nursery the hangers are there, and the nurses what they will do, or even for the mothers also, if mother is wearing gown and going and coming again, once she come out, it is hanged. So repetitively, what happens? The gown has been used again and again with different methods, and sometimes it can happen. The nurses also using the same gowns repeatedly again and again. So what will happen? It will carry the infection and will give infection to the babies. Then during surgical and invasive procedures also we should take care that we should wear the sterile gloves when there are any invasive procedures are there, and the gloves should be latex gloves. Okay, and that is very important when we are dealing with even the surgical procedures. Then vaccination is also very important. When the nurse is working into the NICU, she also should take a vaccine. Okay, influenza, HIV, the hepatitis B vaccine should be taken, and it should be given to the nurse who is taking care of the babies, as well as for the babies also vaccinations can be given to prevent the vaccine preventable infections. Then, while preparing antibiotics and other medications, also very important that we should use a sterile needle and the syringe at each time of medication. What is practice? We we can use that same syringe again. This is what the practice is there, because of poor socio-economical condition. The nurses, they write the medication name and then repetitively it can be used. But what about the microorganisms? Okay, for saving few money, we are introducing the infection, and in later life, the more finances expenses will be there for the parents. So we should see that the from initially only we should strictly follow the aseptic techniques and the clean techniques, and the care should be taken whenever necessary, where the septics we need to follow and where the clean methods we need to follow. Nurse must record the vial, the date, the time when the vial is open. It is also very, very important. The protocols can be given and guidelines can be given, and that need to be followed. Discard open glass ampoules to prevent reuse them for the other babies. Okay. So whenever you see that once it is used and you are not using that to that baby, next dose is not there, so say that it's better to discard, otherwise it can be reused. Discard dilute solutions, sterile water, normal saline when after the 24 hours, depending on the again vaccines and the manufacturer guidelines are there. Okay, so that also we need to follow to prevent the infection. Then education and training is also very, very important. Whatever the caregiver is taking care, that time also we should teach them infection prevention, some measures, hand hygiene, poor handling of the infants, proper handling of the infants, recognizing the signs of the infection. So these all trainings can be given. During cleaning and disinfection instruments and the equipments also we need to follow strict some the routines we need to follow. The stethoscope वगैरह है तो we need to disinfect that. The we should clean that with the like some like cleaning agents we use even for the um, disinfection, that is a zero point 0.5 can be used to wipe the equipment that does not come with direct contact with the blood stream. So that is very, very important. Some incubators, warmers are there, syringe pumps are there. In the phototherapy units, mattress, pulse oxygen hood will be there, ventilator, so that dry dusting can be done. And we can use even the wet wipes to we can use that. The suction bottles वगैरह है तो that should be emptied. Okay, every day I can say we should empty that and we need to change the distilled water. Then ventilator filters are there, can be daily dusting can be done and can be clean. Bag and mask are there, that we can immerse in 2% of Sidex and we can keep for 6 to 8 hours after the dismantling, and the cleaning with the running water also can be done. Laryngoscope, mask, stethoscope, okay, we can wipe with the spirits. Okay. Then after that, walls, floor, the wash basins had to be cleaned with the polysand. Okay, and or the Lysol is also there. Bacillocides also are used into the NICU nowadays, and even the wall cleaning also is done with the bacillocides. 3 times a day, the with the bacillocides, it is better to clean so that the cleanliness can be maintained and prevention of infection will be there. Dustbin, buckets, waste also we need to empty timely, and it should be clean with the soap and the water. Ventilators, CPAP circuits, we need to change with a new circuit. What is practice? Again, wash under the running water and reuse it. But what happens with that? Again, we are introducing the infection to the baby, and baby will fall asleep. Okay, window air conditioner can be used, surfaces with a filter with the soap and water. Refrigerators, the stored and clean separated fridge for the milk and the lab samples. We should not keep the food items, the lab samples, and the vaccines and everything into the same fridge. No, we should see that the segregation should be there. The small fridge we can take for the lab samples, vagera, and other for the food materials to keep it. Then the waste disposal is also very, very important. I can say to you that this waste disposal is done based on again guidelines given by that company. Okay, and we need to put the right waste into the right color coding dustbin. bins or the bins where the waste collections are done. So red dustbins mostly plastic waste such as the catheters, injections, syringe, tubings, bottles. In black, needles without syringe, blades, sharp instruments. In yellow, infection waste, bandages, gauze, cotton. The human body parts of the placenta is disposed. Then in green dustbin, office sanitary, the disposable papers, cup, tissue, वगैरह. So in blue, the glass. So likewise, the whatever the guidelines are be given, so that we need to follow. Then standard precautions also we should use that when hand washing tips techniques we should use universal precautions like a personal protective measures we should use head cap, goggles, gowns, gloves, shoe cover, and the mask is very important. So prevention of transmission of the infection between the neonates we should see that single room isolation can be used for the communicable diseases where the baby there is a susceptibility that baby can transfer the infection to the other. So single room isolation can be used. Visitors need to be restricted. Okay, there we can keep like a no visiting time into the NICU. Actually, to say they should be treated on an individual basis. Okay, because the visiting time if will keep so much rush will be there. Okay, so view the babies through the weaving box. That arrangements can be done. So we through the weaving box the parents or the caretakers whoever wants to see into the NICU they can see the staffing norms also is very important so that rush should not be there. Normal staffing ratio is 1 as to 6 to 8 infant. Intermediate staffing ratio is 1 as to 2 to 3 infants. And the Indian ICU, one professional nurse for every 1 or 2 infants. But the staffing problem is everywhere. Right? One nurse is taking care of 5 to 6 babies. But actually, we should really focus when the nurses are working into the NICU. We should see that 1 to 1 or maximum 2 infants can be given to the one nurse so that the prevention infection can be maintained. So for managing the infection into the baby, we need to encourage the mothers also for some preventive aspects like when she is giving the breastfeeding see that she is cleaning her breast and whatever the utensils are used it should be boiled the vati and spoon. Okay, then frequent hand washing should be done by the mother also. Whatever equipment she is using always it should be washed and sterile. It should be used. The rooming in can be there but also with the use of the gowns can be there. So likewise we need to take care that the babies can be prevented from the infection. There are some equipments that can be resuscitation equipments, bag and mask hai. So it should be immersed into the side egg. Silicone bags and mask hai, so we should do the autoclaving. So this sterilization and autoclaving is also plays a very important role in prevention of infection. Why we are doing all this? To prevent the infection to the baby. Then the laryngoscope, 70% isopropanol alcohol we can use and it can be cleaned. Alcohol should not be used for cleansing as it can cause a opacification. So blurring will be. So we should not use that. Open the care system and the cots also need to be cleaned with the 3% phenyl, 5% isonol. Mattress also should be cleaned. Blankets for autoclaving we need to send. Then laminar airflow we are using to prepare the drugs, fluids, and TPN, that is total parenteral nutrition. We should see that we should go to that laminar airflow, and there itself we need to prepare the medications or whatever the fluids we need to give because near to the baby we are. Doing all chaos and then on that incubator only we are keeping all the IV fluids and this all which will introduce the infection to the baby. Incubators also thoroughly should be disinfected every 7 days. After discharge of death, soon after the discharge, we need to clean every incubator. The 50 ml of formalin into 50 ml of water, we can use that proportion and we can clean the incubators. The mattresses also should be cleaned with the soap and water. Humidification unit, it should be disinfected with the Sidex for the 10 minutes. Rubber and plastic tubings are also there. So actually ventilator for a ventilator which we are using rubber and tubings, those should be used a single use. and then it should be discarded. Infant face mask, 70% isopropanol alcohol. With that, we can clean. But nowadays, for the gas autoclave, we are sending, and that can be practiced. Feeding utensils, the bottles, and if we are using some plates, we need to wash with the waters and then boiled and autoclave also. The spoon or paldai feedings, specifically for the clay flip and clay palette, paldai feedings cups are there, so that also we can use. If they are steel, then we need to boil for the 15 minutes before using. When we are doing any procedure, see that hand washing, sterile gloves, mask, gown, other standard precautions are very, very necessary to prevent the infection. And the disposal of the waste and the soil linen is very, very important. So for that, the beans which we are using, that should be foot operated beans. We should not handle with our hands always, because the hands are most carrying the microorganisms, and that infection can be delivered to the baby very soon. So we should say that foot operated bins should be used, plastic bags as a hamper we should use. A mopping of dustbin also should be done with 3% of the phenol. So surveillance also very, very important. Yes, when the babies are into the NICU, and then surveillance of the NICU is also very, very important. That monitoring the infection into the unit, into the NICU. So we can send a swab also to check the flora whether it is infected, and then through the culture we can know that whether the infection is present or not. And then the fumigation is also very, very important, and that should be done at the regular basis. In infant care, prevention of infection, cord care is very important. Okay, cord care, everyday cord care should be given. Then skin care should be taken. Okay, that skin care, we should not apply different moisturizers, emollient. Only baby emollients are there that we can use. We can use a soft bed वगैरह for the skin care, because the skin is very delicate. Once it gets cracked, the infection will occur. So that, and for the even attachment of the adhesives वगैरह, paper tapes are there. So that we can use than the Dynaplast वगैरह, because again the skin peeling in there, and the baby will have the infection through that the skin. For cord care, we are cord care के लिए हम nowadays actually it is practice, the clean cord should be there. We should not use anything, but previously junction violet also we are using, but we should see that it should be kept clean. Eye care should be given every day. Okay, and precautions during procedures already we have discussed. So there are some nursing consideration we need to follow, that the nurse should maintain a constant assessment, and the documentation is very, very important. If in case the change in the vital signs are there, physical assessment is there, if feeding intolerance is there, whether the baby is responding or not, that responsiveness also should be identified. If it is not there, then they are the danger signs that the baby is having the infection, if the fluctuations are more. Maintain good proper hand washing is also very important. Okay. Then the applying appropriate body unit temperature probes are there. That probes also need to be changed and the clean. Administrating the neonatal antibiotic medications with precautions are also very necessary, so that we can prevent the further infection again. Okay. And whatever we are practicing, see that the proper administrative guidelines should be there. NIC should have other guidelines, so that based on that guideline, every nurse will practice. And if antibiotics we are dealing, we need to check any side effects of the antibiotics are there. Okay. The family also should be teach about the modes, and what are the sign and symptoms of the infection, what is the prognosis, that also we need to teach to the family also. Okay, so they can deal properly with the baby as well as the caretaker. So these are the very important things that we need to take care when we are taking care of the babies. So what care we can tell to the mothers when they are at home, so that the prevention of infection will be there. So frequent hand washing, then clean environment should be maintain. So in home also regularly sanitizing with the high touch area, like doorknobs, countertops, okay, baby gear. So these should be clean. Visitors should be limited. It's not that every visitor is coming, we are giving our baby into their hand with the happiness. No, but simultaneously we are introducing the infection to the babies also. So that should really we should take care. We should not give the more exposure to the baby, and the harmful germs will be there, and baby can be infected. Proper diapering should be done. Soon after the diaper is wet, we need to change. Mothers, most probably it is done that huggies are put, and that huggy is for whole day. So what happens with that? The baby bump rash will be there again. The skin rashes will be there, and so due to that, again, the through that cutting of the skin, or the peeling of the skin, the infection will be introduced to the baby. So we should tell to them that it should be changed, okay, whenever it is wet with the urine or the feces, and it should be clean with the water and the soap that gives skin again. But if though the baby is not passed, still the frequently it should be checked and it should be changed. The breastfeeding is also very, very important, because breastfeeding antibodies are there. We know that because they helps to fight against the infection. So breastfeeding should be promoted to the mothers, and we should tell that it should be continuously the breastfeeding with the frequent intervals it should be given. Safe sleep practice is also very, very important. Okay, but that in that we should see that whatever the crib we are providing, it should be clean. Okay, the keep the babies, whatever the items like a pacifier bottles, toys are there, it should be clean. There should not be it should be dust free. Otherwise, what happens, 3 to 4 days dust will accumulate on that, and then the baby will have again the respiratory infection. Avoid the exposure to the smoke, the cigarette smoke वगैरह है, तो we should keep away the baby from that smoke. Otherwise, again, the immune will be weakened and the baby will fall sick. Stay vaccinated schedule always with you as a mother. We can tell to the mother or the parent so that the baby will be vaccinated and can be prevented from the further another infections. Monitor for illness, because the signs of illness we need to teach that fever, unusual fussiness, if it is there, then redness, if it is there, then they need to come and take the help of the healthcare. So, in conclusion, it is very important that prevention of infection in both the NIC and at home, the proper medical care, proper home care, it will maintain the hand washing, maintaining environment, vaccinated solutions, and safe practices. If we'll have, then definitely we will prevent the infection to the baby, and baby the infection will be minimized. It will support to the baby to have a normal growth and development, and definitely the baby also will be always happy and smiling, and whole family also will become very happy. So these are practices which very much important when we are practicing the prevention of infection to the baby, either if it is in ICU or in the home. So at last, I would say that communication skills, which we have discussed, are very, very important, as well as the some prevention of infection practices are also very important to give wonderful life to the baby, because it is in our hand. If we do not understand the communication, as well as if we do not follow the proper practices of prevention of infection, the baby will fall sick and his life will completely disturb. So to make the baby happy and smiling, it's our responsibility as a parent and caregiver that we should follow some the practices, or the some we need to identify the kids, and we can give them a wonderful, happy life. Thank you so much. If anyone has any queries, can be raised. The future is in our hands. We need to practice it, whatever we are discussing. Thank you so much.
Any participants, any doubt, you can ask, unmute yourself and ask, madam. Or you can post your queries in the chat box. Thank you, ma'am. Thank you so much for taking time for
Thank
being
you
a
so
resource
much.
person.
I think it's more time. It's
No,
3
it's okay,
o'clock.
ma'am. 1 hour.
I finish.
It's on time.
It's on time.
It was excellent lecture, ma'am, with well explanation, very good images in the PPT.
Thank you so much. Yeah, effort, sir. Yes, because the content actually for the communication is not easily available.
Content is reasonable.
Yeah,
It's
but
scattered actually.
yeah,
To make it organized and present it very well, did a great effort.
yeah. Thank you so much.
Thank you, ma'am. I invite Sania, second year MSc nursing student for case presentation.
Okay, just a minute. I will take her. Is the slide visible? Thank you so much, Arunima ma'am, and as well as extend my thanks to the Vaishali madam also. Thank you so much, ECO also, for giving such a wonderful platform to present. Now, Sonia will proceed for presentation. Hello, good afternoon, ma'am.
Can you keep the presentation on
Hello.
slide share format?
Hello. Am I audible, ma'am?
Yes, you are audible. Keep the presentation on slides share format, please.
Can I start, ma'am?
You can start, but please keep the presentation on slide share format.
Yes, I'll start.
Click on enable editing.
Okay, now it is visible,
Yes,
ma'am?
yes.
Shall I start?
Yes.
Okay. Good afternoon, ma'am. Good afternoon, all. Myself, Sania Kirosh Sundar. I'm studying in second year MSc Nursing. So today I'll be presenting here a case presentation. Actually, this presentation I was planned for neonatal resuscitation. So accordingly, I have prepared my PPT. So we'll start. So patient information. The case is baby of age 39 week of gestation, birth weight 2.7 kg, full-term LACS in vivo of meconium stage like that. Baby name was baby of X, age 1 day, gender is female, date of admission 14/10/2024, date of discharge 30/10/2024. Chief complaints were meconium aspiration. Baby did not cry immediately after birth, and birth asphyxia was there. The baby was diagnosed with respiratory distress syndrome. Past history of illness, no any past history of illness. Family history, the family was a nuclear family and baby was the first issue, and there was no consanguineal marriage in the family. No any history of major illness in the family. Then antenatal history, mother registered at nearby hospital, married since 1 year, completed all antenatal visits. She has also taken 2 doses of TT. Mother had history of typhoid and dengue in last trimester, for which she has taken injection ceftriaxone. Mother had also taken iron and folic acid supplements. Then physical examination at birth. So at birth, the baby's vital signs were temperature 97.8 degree Fahrenheit, heart rate 92 beats per minute, respiratory rate 32 breaths per minute, SpO2 80%, and blood pressure 97/7/74 mm of Hg. General appearance, the skin color was acrocyanosis, vernix caseosa was present, Lanovo was present. There was no any birthmark. Apgar score at 1 minute, Apgar score was 5/10, and at 5 minutes it was 6/10. At nose, there was nasal flaring were present. At lips, bluish discoloration was present. At chest, upper chest, lag on inspiration, chest in drawing was present, chest retractions were present, and CRT was 4 seconds, which is more.
On systemic examination, at respiratory system, breathing difficulty was present, crepitations were present, expiratory grunting was present. In integumentary system, skin acrocyanosis was present and CRT 4 seconds. At cardiovascular system, systolic murmur was present due to pulmonary hypertension. The diagnostic evaluation, chest X-ray was done, which was showing patchy granular opacities present in the bilateral lung field, and the collapse of alveoli was seen. On ABG analysis, it was seen that uncompensated respiratory acidosis was present, where pH was 7.2, PaO2 was 46 mm of Hg, which is decreased, PuCO2 was 53 mm of Hg, which is increased, and HCO3 was 19 milliequivalent per liter. Blood glucose was 70 mg per dl, and serum electrolyte and CBC were done, which results are as follows. So here, complete blood count was done, in which hemoglobin was 13.6 gram percent, WBC count was 14,400 per cubic millimeter, RBC were 4.6 gram percent, platelet were 351,000 per ml, serum electrolyte sodium was 136 milliequivalent per liter, potassium 4.8 milliequivalent per liter, and calcium 7.5 mg per dl. So, and nursing assessment was done post resuscitation, where the vital signs were checked as temperature 97.8 degree Fahrenheit, heart rate 143 beats per minute, respiratory rate 56 breaths per minute, and SpO2 was 98%. Anthropometric measurement was done, where height was 49 centimeter, weight was 2.7 kg, head circumference was 35 centimeter, and chest circumference is 32.5 centimeter. Skin color was normal. Respiratory system was showing breathing difficulty was still present. Tachypnea was still present in the child. Respiratory rate was normal, that is 56 breaths per minute, and respiratory grunting was still present in the child. Chest indrawing, nasal flaring, and chest retractions were also was present. Cardiovascular system was showing systolic murmur, which is present due to the increased blood pressure 90 by 60 mm of Hg, and heart rate was 143 beats per minute. Apgar score, which was already discussed, at 1 minute it was 5 by 10, and at 5 minutes it was 6 by 10. Treatment and management. So here immediate management was done when baby after the birth, uh, which included neonatal resuscitation given in labor room immediately after birth, as child did not cry immediately after birth. The aim of the immediate management was to support child to initiate breathing, to prevent hypoxia, to prevent irreversible organ damage, and to save life of the child. So here, the algorithm was followed as we have discussed yesterday. IAP guidelines 2022 algorithm was followed. So first, antenatal counseling and team briefing equipment check was done. So it was after the birth, it was assessed. Well, what was the term of gestation? It was 39 weeks of gestation. Tone was flaccid, and baby did not cry immediately after birth. So hence, baby was warm, dry, and stimulated. Stimulation was done by rubbing the back of the baby, and the position was given as shown in the image, sniffing position with the shoulder roll and neck extending was done, and suctioning was done, where the oral suctioning was done, and then followed by nasal suctioning was done in the baby. So after which the reassessment was done for whether baby has any apnea or gasping. So here gasping was seen in the baby, and heart rate was still less than 100 beats per minute. It was 92 beats per minute. Hence, we went for the positive pressure ventilation, where the pulse oximeter was attached to the right hand, cardiac monitors were attached, and which was showing heart rate was 92 beats per minute, respiratory rate 36 breaths per minute, SpO2 85%, and positive pressure ventilation was given with ambu and bag as shown in the image. These all was taken place nearly exactly 1 minute, which is a golden minute we are considering. So after this, reassessment was done, which was heart rate was still less than 100 beats per minute. So here we went for a endotracheal intubation to ensure the adequate ventilation. Then afterwards, again reassessment was done. Still heart rate was less than 60 beats per minute. So we went for the compression, which we started with PPV at 100% oxygen, where we gave 3:1 compression. We have given. So after this, on reassessment, heart rate was improved, which was 136 beats per minute, which is more than 60. So that there was no need of any IV epinephrine during the resuscitation period. So after this, baby was shifted to NICU, where post-resuscitation care was given. So here, continued mechanical ventilator support with SIMV mode, FiO to 50%, PEEP 5, and rate 49 breath per minute was continued. Prevention of hypothermia by keeping the child in radiant warmer. Blood sugar levels were checked 12 hourly. ABG monitoring was done 8 hourly to maintain the acid-base balance. Child was kept NBM and started on TPN. Surfactant therapy was given where injection Curosur 2.5 ml per kg initial dose was given followed by chest X-ray. Antibiotic therapy, including piperacillin tazobactam 200 mg per kg per day and injection netlifycin 5.8 mg per kg per day, was started. Also, inotropic support was given where injection dopamine 10 mcg per kg per minute infusion was started. Sedative agents like injection fentanyl 2 mcg per kg per day was started. Also, anticoagulant injection heparin 0.25 ml in 25 ml NS at 0.5 ml per hour was started. So here nursing care plan I have prepared for ineffective tissue perfusion related to inadequate oxygen delivery and impaired circulation secondary to neonatal asphyxia based on the objective data where baby did not cry immediately after birth, acrocyanosis was present, hypoxia, SpO2 was 85%, bradycardia where heart rate was 92 beats per minute and respiratory rate 36 breaths per minute. Cold extremities where temperature was 97.8 degree Fahrenheit, CRT 4 seconds, Apgar score at 1 minute 5 by 10, at 5 minutes 6 by 10, and inactive child and flaccid muscle growth. So short-term goal was baby will maintain normal tissue perfusion as evidenced by normal body temperature, normal skin color, CRT less than 3 seconds, strong peripheral pulses, and normal vital signs. And long-term, baby will maintain normal skin color and respiratory rate and breathing pattern. So here the planning was done to assess the heart rate, respiratory rate, SpO2, capillary refilling time every 30 seconds during resuscitation was done for providing real-time assessment of perfusion and guides resuscitation. Second was dry and warm the neonate. Neonate was dried and kept under the radiant warmer to prevent the hypothermia. Position neonate in a neutral, that is sleeping position. Sleeping position was given to ensure an open airway for effective ventilation. Suction the mouth and nose as needed. Oral and nasal suctioning was done to ensure adequate to maintain the patent airway. Positive pressure ventilation was given. Ventilation to support the ventilation and circulation was started because heart rate was still less than 100 beats per minute. Monitor SpO2 and assist in endotracheal intubation, which was endotracheal intubation was done was to prevent hypoxia and even hyperoxia, both which can cause complication. Perform chest compression if heart rate is less than 60 beats per minute. Chest compression were performed at 3:1 ratio, which helps to restore the circulation and oxygen delivery to vital organs. Assess for signs of hypovolemia like pallor, weak pulses, poor capillary refilling, and administer volume expanders if needed. So here IV fluid NS 10 ml per kg bolus was given. It will help to improve the intravascular volume and tissue perfusion in the baby. Then start prescribed medication. So here we have started with inotropic support, that is dopamine 10 mcg per kg per minute, which will help to improve the contractility of the heart. So the expected outcome was met partially as evidenced by normal body temperature 90. Yes. 98.2 degrees Fahrenheit. Then pink skin color, CRT 3 seconds, strong peripheral pulse, normal vital sign, heart rate 132 beats per minute, respiratory rate 43 breaths per minute, and SpO2 98% on ventilator support. Then second diagnosis was impaired gas exchange related to decreased volume and lung compliance, which was based on the objective data of hypoxia, SpO2 97. Hypoxia was not active. It was corrected due to ventilatory support. Restlessness, irritability, acrocyanosis, expiratory grunting, ABG report was showing uncompensated respiratory acidosis, where pH was 7.2, PaO2 46 mm of Hg, PCO2 53 mm of Hg, HCO3 19 milliequivalent per liter, lactate 2.2 mol per liter, and tachypnea was there, that is 62 breaths per minute. The short-term goal was baby will maintain optimal gas exchange as evidenced by normal ABG report, that is pH between 7.35 to 7.45, PO2 95 to 100 mm of Hg, PCO2 35 to 45 mm of Hg, HCO3 22 to 26 milliequivalent per liter, and lactate less than 2 mmol per liter, and respiratory rate 40 to 60 breaths per minute. Baby and long-term goal was baby will maintain normal breathing pattern and respiratory. So planning was done to assess the general condition, to collect the baseline data, assess lung sounds. It will indicate for any alveolar collapse where the grunting sounds and crackle sound was present in the baby. Monitor for ABG and note any changes. 8-hourly ABG monitoring was done to progressive hypoxemia and increasing PCO2, which will indicate the metabolic acidosis. To assess lactic acids were assessed as because lactic acid will indicate anaerobic metabolism. Administer medication as ordered, that is injection by carb administered to maintain the blood pH and compensate the acidosis. Anticipate need for intubation. Assess for intubation in neonate, which will help to prevent the decompensation of the baby due to fatigue. Assess for need of surfactant therapy. Surfactant therapy where injection Curosol 2.5 ml per kg was given to ensure normal functioning of the alveoli. So the expected outcome is met. Child is maintaining normal gas exchange as evidenced by normal ABG where PO2 was 95 mm of Hg, PCO2 45 mm of Hg, HCO3 22 milliequivalent per liter, and pH is 7.31. So follow-up and prognosis, monitor oxygen level and providing supplemental oxygen, treating any underlying infection with antibiotic. Prognosis, in most cases, baby with mild meconium respiration syndrome has a good prognosis. In this case, baby's oxygen level did not improve immediately and even in 48 hours. So child needed an intubation and ventilatory support. As baby was a full-term baby got discharged on 16th day of admission. So problem statement, challenges faced were maintaining a patent airway, ensuring the baby maintained patent airway free of secretion, monitoring for complications such as infection, air leak, pulmonary hypertension, providing emotional support to the family members who were very anxious. Then the nursing management, health education was given regarding breathing and respiratory care. Observe your baby's breathing pattern, watch for sign of difficulty such as rapid breathing, grunting, spraining nostrils or chest retraction. Feeding and nutrition, breastfeeding is highly encouraged as it is help to strengthen immunity and improve recovery. Temperature and environment, maintain a warm body and comfortable room temperature and avoid overheating. So medications, provide all prescribed medication administered in given dose, route and frequency as ordered. Follow here, ensure regular pediatric checkup to monitor lung function and overall growth. Follow up with respiratory therapy or any additional test if recommended. Vaccination should be given as scheduled to protect against infection. Thank you. So this was my case presentation. I'm really thankful for giving me this opportunity.
Sadia, it was presented very well.
Thank you,
Case
ma'am. Thank
presentation.
Yes, thank
Yeah, participants, please feed the feedback form just shared in the WhatsApp group as well as the chat box. The next section will be on Friday, 2 p.m. Same timing. So meet you all on Friday. And fill the feedback form and leave the group, leave the session.
you.